Hello, and welcome to the PaTTAN Behavior Initiative Mental Wellness and Behavior Support Series during the COVID-19, aka coronavirus outbreak. The mission of the Pennsylvania Training and Technical Assistance Network is to support the efforts and initiatives of the Bureau of Special Education and to build the capacity of local educational agencies to serve students who receive special education services. Our goal for each child is to ensure individualized education program teams begin with the general education setting with the use of supplementary aids and services before considering a more restrictive environment. The first in our series is around how do we speak with children regarding COVID-19. Before we begin this session, I'd like to issue a note of caution. This is taken directly from the SAMHSA product that was put out recently about talking with children, tips for caregivers, parents, and teachers during infectious disease outbreaks. The caution reads, be careful not to pressure children to talk about an outbreak or join in expressive activities. While most children will easily talk about the outbreak, some may become frightened. Some may even feel more anxiety and stress if they talk about it, listen to others talk about it, or look at artwork related to the outbreak. Allow children to remove themselves from these activities and monitor them for signs of distress. What is COVID-19? According to the World Health Organization, coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases. Coronavirus, or COVID-19, is a new strain that was discovered in 2019 and has not been previously identified in humans. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. The Pennsylvania Department of Health has currently issued the following recommendations. As far as knowing the symptoms, it's indicated fever, cough, and shortness of breath are the primary symptoms associated with COVID-19, and this often spreads through close contact. The Department of Health also issues to take everyday precautions such as washing your hands, not touching your face, and avoiding sick people when possible. It's important for us to have a conversation around why we have to speak with children about COVID-19 for the following reasons. Every day there are updates provided regarding COVID-19 either through social media, news outlets, or simply word of mouth. Because of the constant stream of communication, there may be some uncertainty that students may feel about their safety given these very unprecedented events. In addition to that, adults are also attempting to manage their own stress and uncertainty. The National Association of School Psychologists and National Association of School Nurses developed a parent resource very recently regarding COVID-19. They provided some specific guidelines for parents to consider as they engage in discussions with their children. These specific guidelines are outlined here. Number one, remain calm and reassuring. Again, knowing that often a lot of information is being given to us at a certain time, it's hard to always keep your calm and composure. But when speaking to children about this particular outbreak, it is important as much as possible to remain calm, simply because children will often respond and react based upon the adult reaction as well. So it's important to be clear. It's also important to emphasize that you and your children are currently fine and that you want to ensure that they feel a sense of safety. Remind them that you and the adults that they encounter are always committed to keeping them safe and healthy. And it's important to allow them, while they discuss their feelings and express how they're coping, that you provide reassurance and allow them to express those concerns with your guidance. Another specific guideline is to make yourself available. During this time, children will most likely require extra attention from you, and this is so that they can express those fears and concerns that they may have and also ask you questions. it is important that they have someone that they can express that to, someone that's available readily. It's also important to give them plenty of love and affection to really keep them as calm as possible. Additionally, it's important to avoid excessive blaming. When things like this happen in our world, it's very often that we want to assert blame on a group or even a country. And in this case, it would be important that we avoid doing that. Sometimes we often can lead to stereotyping around the origin of the outbreak. And with that type of information, it's not helpful with that reassurance and calm. So please make sure that you avoid excessive blaming when discussing the outbreak. One of the other guidelines that is very crucial is to monitor television viewing and social media. It will be important during this time to ensure that any media that your child has access to is factual and will not exacerbate any fears that they currently have. It would be important to keep an eye out to determine if exposure to consistent television and social media is causing anxiety in your student or your child, and be aware that that may be the time to really limit those interactions. This would also be a good time to engage your child in games or other activities that may spark their interest. Continuing on with additional guidelines provided by this resource, it's noted to maintain a normal routine to the extent possible. And when thinking back to how to engage your child in other activities that they may have an interest in, it also is important for them to have as much normalcy as possible in their daily schedule. And even though there may be significant changes that have happened as a result of the outbreak, such as being home from school currently, a routine that has been established at the home, a schedule of some kind, can be helpful to keep some type of structure to help them get through the day, similar to how adults need some form of structure to follow a schedule and get them through their workday as well. It is very important to be honest and accurate. As we said, with a lot of the communications that may be throughout our society, there is sometimes the implication of false information. And so as honest and as accurate as you can be with your young person will be paramount to them feeling that sense of calm. It's also important to know the symptoms of COVID-19. That speaks again to the accuracy and honesty comment. So as we mentioned, the Department of Health through Pennsylvania is able to provide you with symptoms that are related to COVID-19 that is directly from the Center for Disease Control and the World Health Organization. Finally, it will be important to review and model basic hygiene and healthy lifestyle practices for protection. So anything that you can do related to the items that we noted on the infographic provided by the Department of Health, such as washing your hands, not touching your face, and remaining away from people who have been identified as sick or showing symptoms of being sick, that type of basic hygiene will be helpful. So something as simple as spending 20 seconds washing your hands using the chorus of your favorite song, that could be something that's modeled for your young person. Additionally, covering your mouth with a tissue when you sneeze or cough and then throwing that tissue away would also be helpful. These are just some particular items that may support reviewing basic hygiene and a healthy lifestyle to protect them from the outbreak. As we think about how young people react to hearing information related to the COVID-19 outbreak, SAMHSA, again, the tips for caregivers, parents, and teachers during infectious disease outbreaks, actually broke this down by age ranges so that when you're interacting with your child, depending upon the age that they are, you'll have a sense of potential reactions that they may express. So beginning as early as preschool, infant to toddler, 0 to 2 years old, it's clear that at that age, that young person may not fully understand what COVID-19 means, what it means to the world, but they are very much aware when their caregivers are upset. So they may start to show some emotions that mimic the caregiver, or they may act very different. For instance, crying for no reason, or not wanting to play with their toys, or just seemingly different. Additionally, for children, approximately ages 3 to 5, they may have some beginning understanding of what COVID-19 is and that it's something that's causing significant change in their world, their routine, and upsetting to the people around them. So if you find that your child between those ages is very upset by the news of the outbreak, you might notice that they have trouble adjusting to this change. The routine is out of whack for them. This loss, probably the loss of being at school or the loss of seeing friends every day, may be quite heartbreaking for them. So just being aware of that reaction. They may depend on adults around them to fill that void and also, again, provide them with that sense of calm and reassurance. When we move into early childhood or adolescence, ages 6 through 19, reactions tend to change and be very different depending on the age range described. So when we talk about children who are approximately between the ages of 6 and 10, they may exhibit fear of going outside or fear that people around them will become sick. They may also worry if you as their caregiver may become sick. So one of the things that you may see come out of that would be trouble paying attention or doing poorly in school. Now, in some cases, those students aren't in school currently, but just the willingness to want to engage in school type activities may decline. Some may even become aggressive for no real reason. They also may act younger than their age as a sense of needing adult attention and support. And they may even ask to be fed or dressed by that parent or caregiver simply because they're now in a place of fear and wanting that support. For youth and adolescents, ages 11 to 19, it's notable that this particular age range in and of itself is a developmental stage that can also already be a time of significant change for a young person. So given that, it's important to recognize that these reactions may include things like denial of their emotions. When you ask them, how are you feeling about all of this? I'm fine, I'm okay. That may be a consistent response. On the other side, you may see some irritability from the young person. Depending on the age of the youth, they may engage in some type of self-medication, such as alcohol or drug use, to cope with what's happening. And some may also begin to exhibit physical symptoms that's really a manifestation of their emotional stress, such as headaches or stomach aches, etc. So given all of those potential reactions based upon the age ranges that are described, the same document and resource talks about specific tips for conversation by age range. So again, when we consider preschool children, now in the age range of infant to 5 years old, here are some key tips that you can employ. Getting down to their eye level, speaking in a very calm and gentle voice using words they can understand. This can assert a sense of peace, a sense of calm, and that reassurance. Tell them that you always care for them and will continue to take care of them so they feel safe. Again, being as calm as possible and letting them know that they are not only physically safe, but emotionally and psychologically safe at this point. As much as you can, keep normal routines, such as eating dinner together, having a consistent bedtime, any parts of your typical day and the schedule that they have that you can maintain, the better. We understand that a lot of adults are currently working from home and having to manage young children while they're working. So it's understood that that schedule may change a little bit each day, but as much as you can, maintaining some of those consistent markers of a day, such as bedtime or dinner, can really be a help. As we move into early childhood and adolescence, approximately 6 to 19 years old, here are some tips to consider for this conversation. It will be helpful to ask your child or the children the children that are in your care what worries them, what might help them cope. Understanding that for some young people, they may or may not be prepared to express that to you yet, but just knowing that there's an open forum to have these discussions is helpful. If your child is very distressed, and even though you may have a very structured schedule in place just to keep them on some type of balance, please know that if there is high distress, it may be helpful to excuse them from chores or other activities for maybe a day or two. It would also be important to encourage children to have quiet time, just so that they can also decompress. Adults similarly need that time to sort of put all of their thoughts together or just take a deep breath. During this quiet time as well, they could also use that as the time to express their feelings through writing or even art. I know a lot of adults do journaling. Young people as well would engage in a very similar process to help them think about their thoughts, think about their feelings, and jot those things down. For adults too, we want to address our own anxiety and stress in a healthy way. These are very unprecedented events, and so we have to be able to give ourselves grace to handle what we can and be there for our young people as they're looking to us as models on how we handle the stressors that come our way. I can't say it enough how important it is to let children know that you care about them and spend time doing something special, whether it's having a movie night on one of the nights that you're home together, or making a favorite meal, or just doing artwork together. Engaging in some form of self-care that makes the young person feel valued and safe again in this uncertain time. If you do decide to check in on your child often, try your best to be unintrusive with it, so that they are not feeling that you're hovering or that they want to shut down or retreat. And lastly, the consistency of routines will be so crucial as we proceed through these times of social distancing and also adjustments to everyday routines. So completing schoolwork that may have been online or sent home will be something that will be useful, as well as just engaging in family time together, whether that's board games, charades, just having a good time in the safety net of their family. The resources where this webinar originated come from Talking with Children, Tips for Caregivers, Parents, and Teachers During Infectious Disease Outbreaks. The link is in the Outbreaks term. This comes from SAMHSA, the Substance Abuse and Mental Health Services Administration. Additionally, the other resource covered in this webinar was Talking to Children About COVID-19, Coronavirus, a parent resource developed by the National Association of School Psychologists, NASP, and National Association of School Nurses. I want to thank you for your time in listening to this webinar and hoping that this gives you some tips to support your children during the COVID-19 outbreak. Thank you.